is really important is to know that this information will be available to people after the session on the HAAC YouTube channel or YouTube website. So that is important to know so that you can pass that on to people who may not be able to join us this evening and would like to. So all of that said, I am delighted to welcome you to our event that will put our children first. Joining me as facilitators this evening are Dr. David Haase.
Good evening, everyone, and welcome to you all. So I'm a past co-president of HAAC and the co-chair of the Black Physicians of Nova Scotia Group.
And part of our team on the Black Health and Wellness Initiative, and indeed, Veronica Marsman.
Good evening, folks, and thank you for joining us this evening. As Sharon has stated, I'm the co-manager of the ABSW, HAAC Black Health Initiative, who has a mandate to provide health services to people of African descent in this province. I am also a member of the Association of Black Social Workers, where I held the position of president of that organization for at least 3 terms. And I was the first Black president of the Canadian Association of Social Workers. I was also co-chair of the Health Association for African Canadians, where I worked alongside Sharon and Dr. David and other great folks. So back over to you, Sharon.
Okay, thank you. So everyone, this is an opportunity to hear from an esteemed panel of professionals who will share their expertise and experience. I know all would agree that our children mean everything to us. So we want to be clear-eyed about what they are experiencing and how it affects their health and well-being. We also want to talk about what we can do to nurture and protect them so that they live long lives and grow to be healthy adults. So, as has been said, this event is led by HAAC and ABSW, who work and have worked in collaboration with Nova Scotia Public Health, the Department of Health and Wellness, and many, many other partners. The point of tonight is to share information, but it is also to hear from you, the participants, and to answer your questions about the health of our children. And in saying that, I want to underline the fact that all questions are welcome. We may not be able to answer all of those questions, but we can talk collectively as communities to help each other discuss ways that we can put our children first. So the way that we're going to have this unfold is that we'll begin with comments or presentations from our panelists. We will ask that you hold your questions until the end of each panelist's remarks to ensure we have enough time. So certainly after each panelist has spoken, you may have questions for them directly, and that would be great. Just give them a chance to get through their presentation. We will also have time at the end of the event for additional questions. We've put time aside very deliberately so that there's a chance to kind of move into more areas of concern if you have them. Please feel free to state your first name when asking questions. If you're comfortable with that, we'd like to know who we're talking to. So again, this event is being recorded and will be available on the HAAC YouTube channel for anyone who would like to share it or hear it again. So with that, I'm going to turn it over to Veronica, who will introduce our first panelist.
All right. Okay. So our first panelist, the esteemed, the beautiful, Miss Lana MacLean. As the Director of Community Health and Mental Health Canadian-born Lana provides a strategic vision to support the development and implementation of programs that address the nuanced needs of Black, Indigenous, newcomers, differently abled, and 2LGBTQI plus community health needs. She also supports an interdisciplinary team of healthcare professionals to meet the needs of communities where she provides primary care and mental health care while addressing the social determinants of health and striving for health equity. Lana supports a community outreach program for seniors and youth regarding inclusion, food security, and addressing social isolation. Lana is a seventh generation Black Nova Scotian who was raised in the culturally diverse community of Whitney Pier, Cape Breton. Lana has called Halifax her home for the past 30 years. She holds a bachelor's degree in arts and community studies from Cape Breton University and a bachelor and master's degree in social work from Dow. Lana is a lifetime learner and recipient of the 2017 Nova Scotia College of Social Workers, the Ron Stratford Award for Community Social Justice, and the 2023 Canadian Mental Health Advocate Award in Black mental health. And in 2024, she was awarded the distinction of being named one of 100 accomplished Black Canadian women. Lana was the lead consultant tasked with developing the IWK Child and Adolescents African Nova Scotian Black Mental Health Treatment Service. She has a strong passion for health equity, emotional justice, and social work in the lives of young Black women, their families, and communities. Lana's been a role model for young Black women and some of us senior ones. She's a preceptor and provides pro bono clinical supervision to new social workers entering the social work field. Over the past 30 years of practice, Lana has developed community programs to address IPV for Black women and girls. She's created culturally responsive care and race-informed trauma programs and provide counseling models to support Black women and girls in seeking out their healing journey and recovery. Lana integrates the survivor journey into community responsive practice and restoration. Lana volunteered her time to provide trauma-informed counseling in her community when youth were impacted by gun violence. She has the social capital to mobilize other healthcare professionals to also give of their time to provide crisis counseling to youth negatively impacted by gun violence and other community and interpersonal trauma. So Lana is now going to speak to us on Black children's health from her perspective with all of her clinical experience. So over to you, Ms. Lana.
Well, thank you. I need to cut back on that bio a little bit. And the big option, how people got a big expectation. I want to start my comments by reminding us that childhood is a limited space in time in the development of someone's life. We have one chance and only one chance at childhood. And if we don't get the birth or even the birth to at least, let's say, the 18 to 21, people want to say people or young adults up until 31, I kind of want to take that back and say childhood for me is birth, so an infant, right through to the age of 18. That to me is the one chance we have as a community, as Black folk, to get it right. And to get it right is not just the sole responsibility of the parent, it's also it's the responsibility of the community. So children's well-being, their mental health, their wellness is intricately connected with the well-being of their families and our communities. So I ask you, how do we define how our children are doing? We need to be completely honest about how our families are doing and how our communities are doing. Some of us are doing really well. And for the first time, in Nova Scotia, we actually have, and some might say this is good, and some may say, well, this is a challenge. What are we doing about it? We actually have an emerging middle class. And then there's this big gap between us and the folks that I see, which are working poor or poor Black folk. And I think we haven't, as a Black community, talked about the emerging of the middle Black class and how that has disproportionately given some of us some credibility to be very successful and have our children do very well, and I'm one of them. And our personal, and for me, it's your professional and personal ethics. If you think of yourself as someone who is an Afrocentrist or someone who is invested in community, as we do well, we must bring back some of the resources and things that we've learned back to our communities, so the next generation, that we mitigate harm. So what I want to talk a little bit is that, and Karen, I think, can talk a lot about the kids that are doing well, some of them academically. But what we are noticing from the health lens, particularly a mental health lens, is that our children are not well. They are exposed at really early ages to adverse childhood experiences, or ACEs. And in the last 10 years, we've expanded the 10 definitions of ACEs to include the impacts of systemic racism, domestic violence, and violence in communities. So if the average child in Nova Scotia gets about 3 ACEs out of 10, or 3 out of like the conventional expanded ACEs, when I see children and do ACE-based scores, they're scoring above 4 or above 5, which places them in their trajectory to have more difficult life experiences as they age. And those life experiences, from a physical health perspective, is an increase in diabetes as they get older, stroke, stress, and ischemic heart disease. And in Nova Scotia, what we do know is from the data from respirologists is that we have communities that have the highest rates of childhood asthma, and we have some of our communities have the higher rates of childhood diabetes. Ways that children cope in the ways that we love our children is by feeding them as care. And when some of our children are living in poverty and living more sedentary lives, it's actually impacting both their psychological wellness and their physical wellness. So from a social determinants of health perspective, poverty and addressing poverty is a key determinant to look at how well our children will do in the immediate present, but also in the future. I'm a social worker, so with true transparency, I believe all of our families, all Nova Scotians deserve a living wage, so we commit as a mitigating factor to improving the overall psychological, spiritual, and cultural wellness of our kids. As a clinician working with children, one of the things I ask them is about, have you ever experienced, like, not the conventional butterflies? Because I think most people who spend time with Black children know that how we language our mental health is slightly different. On average, most Black children would never consider themselves as witnesses of childhood violence or have violence perpetrated against them, because of the way some of our communities or our culture socializes or normalizes violence in the home, normalizes community violence, and can normalize some of our maladaptive parenting practices that are completely entrenched in Eurocentric ways of power and control. If I beat my kid or if I give them a slap, now I'm not talking about what my grandmother would say, a cuff against your ear. That's about a cuff against your ear. I'm talking about the times in which our children are really experiencing trauma-based harm. And I always like to say, most of the time, our parents are parenting from places in which they have this intergenerational trauma that they're working with and have not even addressed. So are our children doing okay? Some of them are. And there's a proportionality of them that are doing extremely well. But there's also a portion of our children that are struggling with their physical, social, psychological, spiritual wellness, and cultural identity. And what I have noticed is when we look at an African-centered approach to working with children and families, we fail because some of our training reminds us not to talk about the spiritual lives of our families and children. As people of African descent, part of our DNA is enriched in ritual and in practices of faith, or how, that could be, I say church to kids, but we now have a generation of children, 2 generations of children who really have not experienced what it means to be in community and in a faith-based community, whether that is how people about attending church or Sunday school, or going to mosque. Most children who I see who are Muslim children, they still attend mosque. They kind of get rebellious around the 15-year age, but all kids do. So we have to learn how we give children choice around certain pieces. But there are core cultural values as people of African descent that are really enriched in our spiritual life. And I'm a little biased to this because when I look at moral compasses, how our children are being treated, how they treat others, how they show up in spaces, some of them feel, and when you work with anxiety or lack of self or cultural awareness, they lack a sense of that who they are is connected to a larger community, a larger family, and to a larger higher power, however people choose to name that. Letting children know that they are these full vessels and not empty vessels. So giving children an opportunity to explore some levels of independence and choice, we are giving them an opportunity to grow and to learn, and giving them protective factors about how to manage systemic racism and micro-racial aggressions that helps them feel and embeds within them a sense of cultural identity that's pro-social and not linking to things, because what gets amplified in our social media and amplified in our communities. And in some ways, we have not been truthful to our children or to ourselves as community. I might get a little heat for this, is when people are killing each other based on gun violence. We still want to show the good sides of this person in their end of life without taking some level of accountability for some of the choices they may have led that has made a negative impact on family and community that has led to their premature death. So gun violence in our community is a particular factor that I see where children present with lots of anxieties. They are hypervigilant in school. And when they're hypervigilant in school, when there's trauma and drama in their home and trauma and drama in their community, they present at school with all these psychomotor agitations that look like ADHD. They present at school with a lot of worry, which looks like that they're not paying attention, a lack of focus or lack of respect in the class. And then they kind of that impacts their trajectory with their learning skills. So how are our children doing? Some are doing well and some are struggling. And kids do not struggle alone. They also struggle in families. So the development of the African Nova Scotia Mental Health Initiative at the IWK, it's only been in existence for probably, I think, oh my goodness, I want to say 18 months. And in that, it hasn't even had its hard launch. It had a soft launch. I think the hard launch is coming up sometime in June after school is over, or maybe before school is over. And that small team has already seen an increase in referrals to the IWK Child and Adolescent Mental Health Program because we're offering a specific child and African-centered approach to where and how we deliver service delivery to our children and families. We have Black mental health clinicians who are able to bridge and help and recognize the conventional parenting programs need adaptations to meet the needs of our families and our communities. A parenting program for one is not necessarily the same need for a parenting program for others. So shifting some of the narrative about how we parent our children. There are things that we have historically done that are about intergenerational trauma and ways in which colonialism has negatively impacted how we see ourselves as parents. And some of those protective factors also are about the co-parenting of children with aunties and grandparents, and some families live intergenerationally. Some of those things are very protective factors and keep children accountable. In fact, the literature will tell you that when children live in community, in intergenerational homes provide a sense of safety and security and strong attachments, they thrive. Some of our children are living in homes that do not provide safe, secure, and attachment-based care for them. Some children get parentified very early in life. So my comments are, how are our children doing? I think we're at a trajectory where their access to culturally relevant and culturally competent supports around mental health are slowly coming about. Recently, I want to plug the North End Community Health Center. We did a pilot where we actually worked with young adults or young teens in high school. We got a 1-year grant and we hired 2 Black mental health clinicians to help build that capacity. And then the second part of our grant, we heard from these young people because of sustainability of grant funding. They said, we need an electronic tool or a support kit or like a tool bag or toolkit to help us when we're dealing with negative thoughts, feelings, suicidality, because our children are attempting suicide and we don't want to necessarily be wanting to think that our children are feeling that psychologically vulnerable, but some of them are. Particularly a lot of our new Canadian kids who are really struggling with acclimating or trying to find place in space and a sense of belonging. I think it was April the 10th, we had a community launch of our mental health toolkit. It's a free downloadable scan it app that you can just scan anywhere off of the North End Community Health Center's website, and there's certain places. I think, Karen, I gave a copy of this to Sister Darcel Williams-Hart to give out to all the schools. So it's an African Nova Scotia mental health toolkit that looks at the prevalence of 4 major psychiatric concerns that present that Black kids that we did a focus group with said they needed some more literature on and needed some skills. So we hired Dr. Jason Chapman, a well-known Black psychologist here in the city, to develop that toolkit. So it is free for the taking. Just go on our website, nhchc.com, and you can scan it. There's also, and I want to say thank you to these young adults who provided first-person voice about their struggles with mental health and what they found was helpful for them. So our children are doing well because now they feel that there's some ability to access some resources. But are those resources really accessible to them in a timely fashion and in a timely manner? The other is there's some videos that you can download and take the link and help start conversations with young people that we touch in our various communities province-wide to be able to say, hey, let's start having a conversation about our mental health and wellness. Are our children doing well? Again, we only get one kick at the can with these young people because childhood is such a small period of time. You get 18 years to be a child, to a youth, to a young adult. And then we get, for those of us who are long in the tooth, a good 60 years to being an adult. So the question is, how do we plan for the prevalence of substance use with our kids as maladaptive coping, self-harming behaviors, gun violence as a way of resolving beefs or turf wars? Still, even in our community, with all these resources for children to be successful academically, we still have a high dropout rate of Black learners. What are we doing that is protective and or preventative based? And one of the things that I said at a panel this morning is that part of what our investment is in women's wellness and maternal health. and doing things in early prevention, including helping young women and young men learn about healthy relationships. So we can start, I guess, not necessarily stopping the cycle, but disrupting the cycle of violence in our communities. So the one chance that our children get to be children, they get to do it in a safe environment. Thank you for your opportunity and your time.
Veronica, I think it's over to you.
Yeah, thank you. And I was talking, muted. Thank you, Lana. You've given us a lot to think about in terms of how we can even better parent our kids and where they stand in today. If I have one question to ask you, so you've given a lot of impacts. You've talked a lot about what is going on with our young people today. But if you had the magic wand of all of those issues, what do you feel would have the most impact on the kids' social and structural determinants of health?
Oh, again,
like where would you start?
I would actually start with parenting. Back to some old school, culturally informed ways of engaging our children today. Like my daughter Ella, I'm an old parent. I had Ella when I was 42. She's 15, and I had to pivot from ways in which I was parented by an old West Indian woman from Barbados, which, there was never what in the house. There was different ways. But I also was parented in a home in which the importance of who I was connected not just to family, but also to community, but also that I was told that who I am is a child of God. And I think our children need to know that who they are is connected to a higher power. And so I think we're losing from a cultural lens, because I would say if you look at children who tend to do very well, there's circles of influence. Also, they would tell you, the literature, at least the African American literature, would tell you that kids who have been raised in families, whether they're single families or dual family households, Black children do better when they have some tentacle in a faith-based community, because it helps build their sense of self that is defined beyond what the social structures are. They have an internal capacity to identify that you may not like me, but I know that I serve someone greater. And children also then learn, and young adults have this wonderful capacity to actually show empathy and compassion for each other. Those are the skills, those emotional literacy skills that being raised in families and in communities in which, and the African Nova Scotian communities have all been built around faith-based communities, right? And yet we are afraid to actually, as parents, to talk about or engage in faith-based practices that can support children in our parenting of them. It's not that we have to be, always about Jesus on them if that's your faith, or but we do need to have them in our parenting of them to remind ourselves of the value, because I don't think Black parents really think about the importance of attachment. Those are like white Western ideas. And excuse me, when we bring in what attachment looks like in parenting-based programs from an African-centered lens, you get a big aha moment. So I will tell moms or parents, as Karen was talking earlier today, the amount of attachment that I felt, or most Black children feel, particularly Black girls, when their parents wash their hair, take the 3 hours to braid their hair, the amount of emotional attachment that takes place is an African-centered attachment process. Purely the times dad goes out on the basketball court, shoots hoops, Our kids don't always play hockey, but they shoot hoops, or the amount of time that kids learn with mom and dad to do cards, like in Nova Scotia, cards are big, or dominoes. They're watching intergenerationally, and those ways of parenting are what I call the cultural attachment processes that, as an assessor, when I see children being taken into care, I'm like, hold up, wait a minute. What do you mean this child doesn't have an attachment to their parent? And just reconceptualizing what attachment looks like in our parenting practices, because we do some of it, but we do it differently than the conventional ways in which social workers and teachers that we are trained. We have to turn our mind to some of the parental practices that we have done and done with excellence. But we've lost pathways to doing that because we have been judged by our parents by outside sources. So we leave some of those pieces behind, which has been to the detriment of our children.
Right. Thank you so much for that, Lana. Gonna take the liberty, Dr. D. Anybody got a pressing question for Miss Lana while she's on a roll?
And we will have some time at the end as well.
At the end, okay.
Yep.
So over to you, Sharon.
All right. Thank you. Thank you so much, Ms. Lana. I have a strong feeling that this is going to flow into one long and informative piece somehow, because the next person who is going to speak is none other than Karen Hudson. And we are so pleased to have Karen with us. You even indicated that you were with her earlier today, so this is how connected we are. Karen Hudson is from the community of Cherry Brook Lake Loon. She is an experienced and knowledgeable educator with over 28 years of educational training and leadership. Currently, she is the principal of Auburn Drive High School with Halifax Regional Center for Education, HRCE. She is the creator and founder of the first Afrocentric math and literacy cohort in the province of Nova Scotia. In 2019, she was recognized nationally as one of Canada's outstanding principals for her work in embedding Afrocentric principles within the public school system by the Learning Partnership. She is involved in several community organizations and initiatives, including ours. And she was recognized by SMU, St. Mary's University, in 2024 with an honorary degree, a Doctor of Civil Law, honoris causa for her community work. She is also the proud mother of 2 boys and a very, very beloved member of our community. Thank you so much for being with us, Karen, and it is all yours.
All right. Well, thank you, Sharon, and all the other members on HAAC and everyone who has joined us this evening. And I was kind of a little hesitant because I say what I'm going to say tonight. And Sharon said there's so much you have to share. And Lana actually set the stage a little bit in terms of what I do want to share and talk about in terms of the health and well-being of our children. And I'm so fortunate because I get to work in a place that I actually love. I love working with children. I love to see how they grow and they play, how they live. I like to see the joy in their eyes. I like to see how we as educators can model or actually mold them in terms of their physical, their mental, their emotional, the social, and the spiritual well-being that sometimes get distracted a little bit because of all the worldly things that exist. But I am not naive, and I do recognize that even though I say this several times, I believe just like in the health system, the education system wasn't designed for our Black children. And I also believe that within the health system, it was not designed for our people as well. And that was due to various issues that existed. The social, going back to the economic, the political conditions, the access to health access to education, Also, when we think about employment, and then Lana spoke about the mental health, the inequities that exist, the institutional racism that exists as well. There's a lot of health inequalities that exist that our students are not aware of. But one thing that I do know and I do believe wholeheartedly is that our community and the Black families, they are important, imperative in terms of who will help us become the people that we need to be. And so for children, they need to have that structure of family. And so I see our school system, I see the school where I work at, Auburn Drive High, as a structure, a place where we can provide sometimes that love and that happiness and that joy, that strength that our children get from the home. And even though sometimes our families may not have had or felt that they were ill-equipped, they were equipped with lots of values and morals that our children needed so that they could be successful. And they had that strength and that support and that care. And so when I think about our children, even when we talk about, and I was talking today to our students and I was just saying, do you know about the measles vaccine and what's going on? And some of them weren't even aware. The lack of information that's disseminated from the children, even though they're in the school system, at the level that I have, the high school level, they don't know, they're not aware. And I'm saying, you get a vaccine? And they said, Miss, that was during COVID-19 days. And so I said, okay, but there are things that are happening today that our children are not aware of. When they're younger and they're going through the education system, we spend a lot of attention making sure, actually, even when they're born, making sure they get the proper vaccination, 6 and 11 months and all the way up. And then we start to dwindle away and forget that our children, even as us adults, we still need information. So how do we get that information out? As education system, we are supposed to do that to make sure that our children are aware. But the lens that it comes from in terms of Black children, that equity lens, so that they understand that it will affect them and that they don't have to be afraid of it. And so how do we prevent or make sure that there's a way that we reduce those diseases and that we understand that these vaccinations are important for us? How do we provide that if your child doesn't have a chronic illness? So if your child has a chronic illness, you're more aware of it. The parents are more aware, families are more aware. So we as educators, health providers, we've got to play a stronger role to make sure that the information is given to our most vulnerable individuals. We need to make sure that we protect them. And so as educators, that's what we try to do, is protect them. And so I said to one student, I said, measles is happening all over. Are you aware? She said to me, Miss, I have a phobia of needles. So if I can avoid it, I ain't getting it. And so we got to have these conversations with our children because sometimes, there's misconceptions, there's ways that we can get the vaccination. But when COVID-19 was happening, students were a little hesitant of it. And so I said, if you can't get to the space, we can bring it to you. And that's what we did. We made sure that it was available, that there were sites available nearby, even through HAAC. There were clinics available where students can make sure that they could come, and as long as you were 16 or so, that it was readily available. But there was information that was going out. And I feel sometimes that even for our educators, and even as an educator myself, Lana talked about that cognitive development. We also have that within our education system, that our children, in terms of language development, there's that negative perception that our families don't know. They do know. It may not be communicated the same way as others, but they will be able to communicate to their child that this is important. So we got to make sure that we create the language so they understand that today it's important. We might not have had within our homes or our communities libraries. but that's a way of information. And we have social media where students can get information. You know, how are we getting that information to them? How are we intervening with those resources and not just thinking about traditional ways, but, you know, non-traditional ways? Yeah, schools are important as well, but conversations is also important. So when you see somebody, you know, you have to have conversations about that so that they don't have those biases, that they are giving that they're getting the true information, the facts, as compared to the misinformation that sometimes that they see. We also talk about the impact of families, and I see with starting the cohort, I see that as being one big family. And I see the role that schools can play in terms of creating safe spaces for our children. So children can feel value, so that they can feel that they're loved, but they also can feel that sense of community, that collective way of doing things. And I think that that's one of the things that our children are missing, is because there's so many challenges that they need to navigate against all the time in terms of institutional racism, discrimination, different practices that exist for our children. But we, as a community organization, we have to partner with the schools, other organizations, so that we can champion the people that we value. We also talk a little bit what kind of practices, approaches can we use? Well, hopefully the equity lens, the Afrocentric lens, but a trauma-informed lens as well. You know, our education system, it created some harm, and that's just a fact. And so we got to realize that. But one of those things that we can do is try to help our children understand that, yeah, it's okay, like if you're struggling mentally, because within the community, our children want to hide that. Even families want to hide that my child is struggling with mental illness. Sometimes we can't see it, but we can see when you have a broken bone or you have a broken leg or arm and you're saying, how are you doing? But what about when your mind is not doing well? We as educators got to make sure. And so that's one of the things I try to do, is just make sure that our children's mind is doing well, that when they come through that space, that they feel safe in that space to be who they are. So knowing themselves culturally, their identity is so important. And that's the one thing we try to talk about all the time in our school. We make sure that they're represented, that they're visible, that they see themselves, and that they're being seen. Not just that they see themselves, but they're being seen by others who come through those doors. And when children feel that you see them and you value them, then you can have that productive type of conversation with them. And so that is what we're trying to harness, is with children that you can't see the mental strain that we put on them day after day after day. So how do we manage that so that our children feel that, you know, it's okay, I'm struggling today, I got a lot of things going on, and I need some help. You can't see it. You can see broken arms and everything like that. But we have to be more aware of our children and their actions. And so that comes with a lot of other things that we need to do in terms of making sure our families are aware and they're okay to name it. We say name it. Don't just say we're talking about people of African ancestry. We're talking about Black children, Black Nova Scotian, you know, people of African ancestry. We got to name it and call it what it is. And so that's one of the things that we're trying to give voice to our children, so that they can say who they are in a way that they be proud of themselves. And I think that they're becoming more proud of who they are now, because we're starting to call them, you're Black, be proud of Black. When we were growing up, they said, I'm Black and I'm proud. And it was okay to sing those songs. It was okay to, you know, you had a sense of spirituality. And Lana spoke about it in terms of religion, but feel good about that religion, that's going to propel you even further when you have something inner, because nobody can take away that inner strength, that intrinsic way of doing things. And so this is what I think in terms of our children, that stigma, that they're fighting it all the time, that internalized and externalized stigma that they're fighting within the school system. And so they need to feel a sense of belonging. They need to feel a sense of well-being. They need to feel a sense that, that they can improve their health and that there's ways out there for them, but they need the resources. They need the avenues where to get the information from. They don't need, if they don't know where to go, we have to be able to provide that access for them. And we need to collaborate with each other. And I just feel that just because, there are early programs that we're now developing, well, we need to keep those programs going on because our children's education doesn't stop. Each one of us that are on this call, we say we're lifelong learners. Well, we want our children to be like that as well, lifelong learners. So that, yeah, you got them in babies, you got them in elementary, then you got them in middle school, then you got them in high school, then they may go to community college, they may go to university, or they may go to employment. They're still our children. And so we still need to work with them so that they understand that we are here to assist you. If they're struggling with getting affordable housing, that's a well-being thing as well. That plays on their mind. They're struggling in terms of their money. That's a well-being thing. They're struggling about, they have a child early, even before they finish university or whatever. And then we got to help them with that as well in terms of parenting. Give them the skills and the tools. Lana spoke about that toolbox, that mental health toolbox. Our children need that every day so that they understand where to go, so that they can feel when they walk through those doors, that those doors are open for them, that they're not closed. We had enough closed gates before, but we have to make sure that the doors are open so that our children feel when they walk there, they walk proud of who they are in their own skin. And so navigating all those social exclusions, the affordability, navigating even about who they are in terms of their spirituality, those misconceptions and the hesitation. And I'm going to just add on this last note from the young girl I spoke to today about that needle phobia, because it's real. It's real in terms of what our children are afraid to get, of the information that they've heard. So we got to go back to where we started. Community and families, they are our first learners and our first educators. Ms. Sharon, I think that's all I want to say right now.
Well, I just want to say beyond, there are no words to say thank you sufficiently for your passion and your commitment, Karen. We are aware of that, and we are very grateful that you are there as a leader in education in our schools. And I guess I would ask one question, because of course we're always up against time, but here is one question that I would like to ask you, and then we can come back later at the end of the session and ask more. As a highly respected educator, what do you want to see? Just one thing you want to see Black parents, guardians, and communities do better to protect our children.
What do I want to see in terms of that?
Yeah, just one thing that you'd like to see.
Oh, I would like to see them involved. I want to see them involved from the time that they conceive, or sometimes you don't even have to be a parent, but if you're if you go back to the African Nova Scotian way of the village and thinking of the whole community, I would like to see us that wraparound service where we just spread our arms and that we don't let anyone left out. One of the things that we say within our community, within our school, is that, especially within the cohort, we say that you are all responsible for each other. And so I want to see that where we each are responsible for each other's behavior, that we make each other accountable as Black people. I want us to go back to that Afrocentric way, where if you knock at a door, or if you saw somebody that was there, and I know today you don't even chastise them, or you don't even call them up, call people up and say, I saw your child and this is what they were doing. That we need to be a little bit more involved in our children, in their behavior and their actions. Parents are very appreciative of that. And I know community sometimes we get standoffish because we know of things that are happening. some things that are out of our control. But I know that people witness, and I'm going back to the gun violence. It's out of my realm in terms of all that, but I see it and I hear it, and it affects our communities. It affects our school communities. It affects families. So how do we get back to that whole approach? And I guess it's going back, maybe I say family or the involvement of families, by going back to that trauma-informed kind of approach that we want to use so that nobody will be hurt by those harms that existed because of racism or discrimination or violence, for not being part of the curriculum, for being left out, or for just being ignored.
Well, thank you so much. And I think that you have made a very important point that parents, guardians, communities all have a vital role to play in the health of our children, and we have to stand up and fight for them. That's what I'm getting from what you're
Yes,
saying.
that's correct. That's what I'm saying. Thank
All
you,
right.
Sharon.
Thank you so much. All
You're
right.
welcome.
I'm gonna hand it over to Dr. David
Okay.
now, who's going to
Thank you,
introduce our
Sharon.
next panelist.
And Karen, I do echo Sharon's comments as well. Thank you. So it gives me great pleasure now to introduce a friend and colleague, Dr. Upton Allen. So Dr. Upton is Professor of Pediatrics at University of Toronto and Chief of the Division of Infectious Diseases in the Department of Pediatrics at the Hospital for Sick Children. He's also interim director of the Transplant and Regenerative Medicine Center at the Hospital for Sick Children. He's a senior associate scientist in the Research Institute, again at the Hospital for Sick Children, and he's cross-appointed as a professor in the Institute of Health Policy Management and Evaluation at the University of Toronto. Dr. Allen received his medical degree from the University of the West Indies, my alma mater as well, in Kingston, Jamaica. He received pediatric training at the Hospital for Sick Children in Toronto and had further research training leading to a degree in clinical epidemiology from McMaster University. He's the past director of the Infectious Diseases Society of America and fellow of the Society. He's a fellow of the American Academy of Pediatrics, fellow of the Royal College of Physicians and Surgeons of Canada, and fellow of the Royal College of Physicians in the UK. He's also past chair of the Infectious Diseases Specialty Training Committee with the Royal College of Physicians and Surgeons of Canada. His past awards include the Clinical Science Established Investigator Award from the American Society of Transplantation. In 2018, he was awarded the Order of Ontario, which is the highest honor awarded by the province of Ontario. In 2020, he was recognized by Toronto Life magazine as one of the top 50 most influential people in Toronto. In 2021, he was honored with an appointment as Commander Order of Distinction, Jamaica. He's the recipient of the African Canadian Achievement Award, as well as the Harry Jerome Award In 2023, he received the University of Toronto President's Impact Award for work done as a member of the Ontario COVID-19 Science Advisory Table, for which he was a co-chair. This table was a vital source of evidence-based analysis informing Ontario's response to the COVID-19 pandemic. In addition to being a general ID specialist, he's actively involved in clinical and research activities relating to immunocompromised patients, notably those who have undergone organ and stem cell transplantation, as well as cancer therapies. He has a major research interest in Epstein-Barr virus-related post-transplant lymphoproliferative disorder. That's a mouthful. As well as an interest in respiratory syncytial virus infections. He's had many academic and professional accomplishments. He's had numerous invited lectures internationally, visiting professorships, more than 350 scientific publications, scientific abstracts, several book chapters, and several peer-reviewed research grants. He's led research studies on different aspects of COVID-19. And within the Black communities in Ontario, he led studies addressing COVID-19 seroprevalence and the associated risk profiles, as well as immune responses to COVID-19 vaccines. He's worked closely with a variety of groups addressing COVID-19 among racialized groups. And he's also board member and chair of the Health Committee of the Black North Initiative, with a focus on equity, diversity, and inclusion within the healthcare system. He chairs the Ontario Public Health Scientific Advisory Committee and currently leads a large national study funded by Genome Canada to examine genomic factors associated with susceptibility to selected chronic health disorders that are prevalent within the Black Canadian population. So, Dr. Upton, great pleasure to have you here with us. And please give us your perspective on Black children's health.
David, thank you so much. I must thank you personally, my good friend and a fellow graduate of the University of the West Indies. David, thank you for inviting me, and of course, to the other members of the planning committee. Thank you so much. Great presentations by Lana and Karen. And Karen's presentation fits and actually mine will flow quite nicely from Karen's because one of the things that Karen pointed out is the importance of ensuring that our families are equipped with information and correct information. And in that regard, that's going to be my focus, David. And I'm going to use some slides. I'm going to be focusing on vaccines. Let me first ensure that I can get the slides up. And you let me know if you can see.
Yeah, we can see them.
Excellent.
Just to start your slideshow.
I just need to do the slideshow.
Yeah, there you go.
Excellent. So I'm going to focus on one component of where Karen left off, and that is just ensuring that our families are equipped with correct information. Because when it comes to vaccines and vaccinations, it's really important to recognize the bottom line. The bottom line is that everyone has a right to decide if they want to be vaccinated. But we want to ensure that when they do make a decision not to be vaccinated, that they are making that decision based on correct info. They must be using the right information. And there's nothing more painful to me as a clinician to see many of our Black families make the decision not to have their families vaccinated. And when you ask them why, you realize that for years and years, they have been acting on wrong information. And when you correct that, you get a complete turnaround. And so I'm going to show you, this is an outline. I make some introductory remarks. I'll use some vaccine success stories to illustrate the importance of childhood vaccination. But I'm also then going to focus on 3 or 4 key points that are often the subject of misinformation, issue around relating to autism and vaccines, mercury containing compounds, adjuvants and additives, and then end with some comments on vaccine-related adverse events or surveillance. This is a schedule of the childhood vaccines in Nova Scotia. I put this up more to help me to just ensure that I wasn't going to miss anything with respect to the schedules in Nova Scotia. So it's often good for families to be aware of these schedules themselves. And so in relation to the information that Karen alluded to, just being aware of what your child or your children should be getting and when they should be getting them, I think is also helpful. And then, of course, what is available for them to get in schools. Now, over the years, we've seen the success stories of vaccinations. We can speak of the eradication of smallpox, but when we talk to kids about eradication of smallpox, they don't know what we're talking about because it's been eradicated. Um, uh, but I thought I'd use an example here of chickenpox. And yeah, when I was in training in Toronto uh, in the 1980s, there are lots of chickenpox cases around in Toronto, in Ontario, in Canada, and in North America. A vaccine became available in the late 1990s, directed at chickenpox. And this slide shows in this tealish looking color, you can see where in 1997, when the chickenpox vaccine was introduced in the United States, the uptake was actually poor, like 26% coverage when they were aiming to get more like 80s to 90s. 1998, 1999, you can see a gradual increase in the uptake of the vaccine as information about the vaccine and its safety became more available. Now, if you look at what happened with respect to the chickenpox, or otherwise called varicella surveillance in the United States, was this red line that as the vaccine coverage increased, the number of cases decreased. Here it's in California and West Philadelphia. But what is even more impressive is that when you look at vaccine-related hospitalizations during the period 1994 to 2002 in the United States, you can see a dramatic decline in the number of hospital-related varicella admissions. And this was particularly pronounced in children under the age of 10. All groups saw a decline, but particularly pronounced in the children under the age of 10 years. But when you also look at not just the number of cases that went down, you look at the number of hospitalizations that went down, you look at mortality among individuals under 50 from 1990 through to the early 2000s, you can see the dramatic decline in the number of people dying from chickenpox related illnesses. So this is an example of one disease entity that is often benign as a cause of illness in many healthy individuals, but in some persons, it can result in terrible outcomes, including mortality. And that has been, just to a large extent, prevented by the use of a vaccine directed at chickenpox. One of the complications of chickenpox in children, and David's aware of this as well, and in adults too, is that you sometimes can get the chickenpox lesions becoming secondarily infected by a streptococcus bacteria that causes flesh-eating disease that you hear about in the news. That's the same bacteria that resulted in the death many years ago of the creator of Muppets, Jim Henson many years ago. He died from that particular entity. But let me now focus on some of the specific misconceptions that are often out there that adversely influence decision making when it comes to Black families and other families when it comes to having their children vaccinated. Vaccines, autism, and thimerosal. Now, thimerosal is an ethyl mercury-based preservative that's present in some vials of vaccines. These are multi-dose vials. And the real purpose of this is really to prevent germs and bacteria, other organisms from contaminating the vaccines. And for many years, people have talked about whether or not this particular entity might be associated with autism. We now know, and there's really a lot of data that credible research studies have found no link between vaccines and autism. In the early years, when you ask doctors about whether or not vaccines cause autism, they would say, well, you know, we have no data to suggest that that's the case. We can now say we have data to indicate that's not the case. So vaccines are not associated with autism. Lots of studies, I've just shown you a few here. There are many more studies now on the lack of association between vaccines and autism. Now, often our families will come in and they will say to us, well, yeah, I don't want my child to get the MMR vaccine because it has this mercury thing in it. It has thimerosal. And we can confidently say to them, you know, guess what? In Canada, the MMR vaccine that we use has never, ever contained thimerosal. And often they'll pause and say, really? You know, I've been thinking this all these years. Never, ever contained thimerosal. So giving them the right information is so important. There are various additives sometimes that are added to vaccines. I've made reference to the thimerosal issue. And also, not only have the MMR vaccines that have been used not contain thimerosal, no vaccine made in Canada since 2001 for use in children contains thimerosal. So that's also important. The exception is the flu vaccine that I'll come to in a minute. And the diphtheria, tetanus, and pertussis, polio, Haemophilus influenza B vaccine, those vaccines have not contained thimerosal since about 1997 to 1998. So these are important bits of information for families to know. And in fact, not only the families, but others who are involved in providing information to families so that when families come with questions, they can correct them, and that can help to enhance confidence in vaccines. Now, the flu vaccines, the multi-dose vials do contain thimerosal to prevent against contamination of the vial. Most single-dose vials and pre-filled syringes of the flu vaccine, though, as well as the nasal influenza flu vaccine, the spray vaccine, those do not contain preservative because they're just single use. So the caveat here is that the flu vaccine, the multi-dose vials, do contain thimerosal. Now, we hear about other products that people are concerned about, and they sometimes families will bring up the use of aluminum salts, which are used as adjuvants to enhance the potency of the vaccines. And these adjuvants have been monitored for many, many years, like, you know, well over 80, 90 years, and are regarded as being safe. Interestingly, when we have conversations with families, David, we often point out that people have raised concerns about their kids being exposed to aluminum salts through vaccines, and point out to them that the amount of these aluminum salts that are present in vaccines is about the same amount that's present in breast milk and infant formula in the foods that we eat. So it really isn't an issue. Formaldehyde is another uh, uh, product that might be present in the vaccine vials in tiny amounts. And this is directed at inactivating viruses and toxins. And most of this is actually removed during the vaccine purification process. This is really important. So really removed in the purification process. Um, it's important to note, though, that there's about 10 times more formaldehyde in an infant's body at any time than there is in a vaccine. So again, from natural exposure to food and drinks and in our environment, we have much more there's much more likelihood that these would result in great amounts of formaldehyde than what we would get from the tiny amounts that might be present in a vaccine vial. And I alluded to the fact that most would have been removed in the purification process. One of the questions that we sometimes get directed at us, David, is that, well, what about the immune system? My child is getting all these vaccines. Can their immune system cope with all these vaccines? This is a very common question. It comes from healthcare workers as well. And it's important to recognize that our immune systems are challenged by millions of antigens on a daily basis. At a child's 2-month visit, there's probably somewhere in the region about 30 plus antigens based on all the recommended vaccines for that particular age. However, in theory, an infant's immune system has the capacity to respond to about 10,000 vaccines at any one time. Nobody would ever do that. It's really just meant to illustrate that the person's immune system could take about 10,000 vaccines given one visit. That's no one would ever do that. But just to illustrate that the idea that the immune system would be overwhelmed is just not realistic based on the theoretical argument of how many different types of antigens we're challenged with on a daily basis as we walk through the parks. So our immune system is very resilient, very strong in that regard. David, I'm going to stop there. I wanted to say, well, maybe one last thing, and that is that when we do have new vaccines that come on the scene, it's important to recognize that not only have the vaccines been tested in preclinical work, but they've been tested in clinical trials, but that the surveillance for safety does not stop there. That once the vaccines are in clinical use, a process of vaccine surveillance for adverse events is then put in place to ensure that if there are any side effects that are developing, any safety signals that are developing, an alarm is going to be sounded. And over the years, there have been some vaccines that have given rise to safety signals that have caused a change in the way the vaccine's been used or a cessation of use. So it's important for families to recognize that even when their children have been vaccinated and they left the doctor's office, years later, monitoring is still in place to see if there are any safety signals that have popped up. So I'm going
Great,
to
thank
stop
you.
there. Happy to
Thank you
take
so
any
much.
questions.
So Upton, that was great. And I'm just going to ask you one quick question. So as a Black pediatric ID physician, what's one thing that keeps you up at night when you think about our Black children's health? Is there one thing that you've talked about a couple of things there, but is there what to you is a
You know, David, during the COVID pandemic, the COVID vaccine brought into focus one of the things that kept me up at night, and it really did it. It really kept me up, and this was the observation that many of our families were making decisions based on completely wrong information. And I was scratching my head and was trying to figure out why. Why is that so? And I think Karen addressed some of this. We need to ensure that we have pathways of information that allow these Black families to be equipped with the right information. Because making decisions based on wrong information, that is so painful. I can
yeah.
cite many examples of that, David. So I think the right information, that's so important. Now we can talk about the pathways of the information, and the others like Sharon and others will be more expert at this than I am. But I think that one of the things that is important is for a closer partnership between schools and the healthcare system to ensure that uh, we have adequately equipped our children with the right information around science and health science literacy.
Okay.
And I've been concerned that during the pandemic, we saw major gaps where parents, their scientific knowledge was suboptimal. And that because of that, people could, come through YouTube, WhatsApp, whatever social media channels there are, provide them with wrong information. And unfortunately, even if they didn't believe it initially, it certainly influenced some of the decisions. So I think
Yeah. Okay.
enhanced scientific literacy
Yeah.
is really important, and
Okay.
it ties in
Great.
with my concern, what keeps me up in
Yeah.
information.
All right. Thank you so much for that. So that's a perfect segue, Sharon. Over to you.
Yes, indeed. Thank you, Dr. Upton. And yes, it did. It gave us some specifics, and those charts and that information is key to our collective understanding tonight. Further to this, we are privileged to have with us Angela Harper, and I will just introduce her now. Angela Harper graduated from Dalhousie School of Nursing in 1991 and is a baccalaureate prepared registered nurse with 34 years of experience. She is currently employed with the Early Years Program, Central Zone Public Health in Nova Scotia Health, or for Nova Scotia Health. Her work with the Early Years team allows her to provide support for families during the perinatal period. She works with various communities and organizations in Central Zone, Nova Scotia, including the East Preston Family Resource Center. This work includes collaborating with community members and Family Resource Center staff to provide perinatal education, parenting advice, support, as well as providing immunizations to junior high school students. Her previous work with public health includes work on the health protection team with a focus on communicable disease prevention and control. She was also employed as a public health nurse with Indigenous Service Canada from 2022 to 2023, and has worked in remote Northern Indigenous communities. But we are delighted that she is back with us in less remote communities And tonight she is going to bring her expertise to our focus on our Black children. And Angela, without any further ado, I sure would love to hear what you have to say to tell us tonight.
Well, thank you for the introduction and thank you to all the speakers. Everything's been so informative. And really, what I have prepared is some updates for parents regarding two specific programs that uh, will help keep our children healthy in Nova Scotia. And one thing I do want to add that I hear the other participants been talking about is that link between the healthcare system and the parents and the children, and the responsibility it is to educate people about health issues, immunization, parenting, and I think about public health and the work that we do, and I challenge people to, I do my best at public health to advocate for families, parents, the healthcare system, and schools. And I invite people to challenge public health as I do. I work for public health and I still challenge them um, that we are responsible to educate people, to be in the school educating parents and families about immunization and helping them make an informed decision for their families and for their children. So one program that I wanted to talk about was our school immunization program, which starts in grade 7. And this program provides immunizations for hepatitis B, HPV, which is human papillomavirus, meningococcal disease, and tetanus and whooping cough booster. And so I hope there are some parents that are listening on the line, and so that they'll understand the importance of these vaccinations. And with hepatitis B, it's a serious liver disease, and people who have hepatitis B for a long period of time, a lot of people develop liver cancer. And with the human papillomavirus, that virus we know also causes cancer. It causes cancer of the cervix, it causes penile cancer, oral cancer, as well as anal cancers. And the meningitis we know is a very serious illness, and it often results in death, unfortunately. And the tetanus and whooping cough are also very serious illnesses. And whooping cough, specifically, when children under the age of 1 are infected, it can result in brain damage and death in those children as well. So in the school program in grade 7, consents go home at the beginning of the school year, in the fall of the year, and they go home by email. And it's the same email that you provide for your Power School contact. And parents or guardians can reach out to the school immunization champion for any questions regarding the consent and immunization process. And they can certainly connect with the public health nurse if they need further information and to make an informed consent. And one thing that I did want to mention that's important is that in terms of vaccination, there is no age of consent in Nova Scotia. So if a child, once they have had an assessment and the public health nurse deems that they are competent and confident and that they understand immunization and the disease, the child can consent to have a vaccination. And of course, we do make a courtesy call to home to let the parent know that the child has consented for vaccination. One thing that's important for parents to know is that once your child turns 19, they're no longer eligible for free hepatitis B, meningitis, or HPV vaccine. They certainly can receive the vaccine, but they up until age 19, it's free of charge. Once they turn 19, they have to pay for those vaccines, which are very costly. And sometimes when people turn 19 and they're not in school, they kind of forget about the the vaccines and the illnesses. So that's really crucial. That parents know that and that children know that. So what children can do is at any point in time during their school years, if there's any vaccine that they either refused or missed, they can receive those vaccines. So, for example, if in grade 7, parents and child said no to HPV vaccine, they can receive that vaccine at any point in time while they're in school up until age 19. And a public health nurse will arrange for the child to come to the junior high or wherever, maybe the public health office, so they can get caught up on their vaccines. And unfortunately, in public health, we don't collect race and ethnic based information. So I am not able to tell you the rates of vaccination for any specific ethnic groups, particularly in our Black children. That information isn't collected. I do know that last year, the schools that had the lowest vaccination rates amongst all the schools were the schools of Halifax West, in Central Zone, and CP Allen. And then with the resources that are provided, that Dr. Haase will provide, there is a Central Zone immunization line where parents and children can call if they want to look at their vaccination records and see if there's any vaccines that they're missing so that they're caught up before they complete grade 12. There's also a vaccine program for infants and toddlers, and that's for anyone that doesn't have a family doctor or a nurse practitioner. And public health can review the records and they can provide vaccines for any children and toddlers at the public health office, or they can arrange for vaccine to be given at a pharmacy or at a primary care office in the community. So the second program that I'd like to talk about that supports Nova Scotia children and families to be healthy is the program that I'm currently working in, which is our early years program. And so that program provides prenatal and postnatal support to families and birthing parents. And this program is delivered by a public health nurse. The public health nurse can provide information about postnatal adjustment, growth and development information, mental health, wellness support, addiction information, labor and delivery education, nutrition, breastfeeding, chest feeding. So that information can be provided in the comfort of the family's home, and or can be provided online, by phone, and it's prenatal and postnatal education. And this is provided to all families. So a parent or a mom can they can self-refer to public health for that information, or they can be referred by primary care. And that information is available to everyone. Doesn't matter where you live. That program is the same across the board in Nova Scotia. And the other program that I want to mention is our enhanced home visiting program. And this program begins with contact from a public health nurse, and it pairs a birthing parent with a community home visitor. A community home visitor is an individual who's trained in child growth and development and can deliver a parenting course in the client's home. So the focus is on child growth and development and attachment, and they can deliver that program until the child is 3 years of age. And the last program that I want to mention is a new program, and it's called the Nurse Family Partnership. And this program was developed in the United States. It's been it's evidence-based, researched, well proven. It's been around for probably 20 years, and it has been in countries in Europe and several other countries. And in Canada, British Columbia, Ontario, and have already adopted the program in some of their zones. And Nova Scotia is the third province in Canada to develop this to have this program. So we are currently going through training now. It's an in-depth training. It's about a 4 to 5 month training. It's for registered nurses. So the home visitor is the registered nurse. And I'm happy to say that I will be one of the charge nurses for the program. And it pairs a birthing parent with a registered nurse early in pregnancy. So before 28 weeks gestation, and it continues until the child is 2.5 years of age. And the goals of the program are to improve pregnancy outcomes, improve child growth and development outcomes, and to improve family economic self-sufficiency. And the focus, one of the focuses of the program is to foster secure parent attachment. And the program really focuses on clients who are most susceptible to social determinants of health. So it's looking at prevention. We look at intimate partner violence, relationships, education, mental health, growth and development of the child, and the family unit. And so in terms of diversity on the team, so there's myself, and at the present time, there are 3 other nurses of African descent who are on board with the program. So like I said, there'll be more information to come in the future once we're fully trained. So we're going about the training right now. There are 2 other supports that I want to mention for families, which you may or may not know of, and that's the doula program, and it's the Black doula program, and that was developed by the Wellness Within organization, and it celebrates Black birthing and Black joy, and it's written by a Black woman for Black people. And the other program that I want to mention is the Parenting Journey Program for African Nova Scotian parents. And this program is based out of the East Preston Daycare, and it's a family support program that provides home visiting to promote healthy growth and development for children and youth from ages 0 until 16 years of age. So really, those are my updates, and I hope that I was able to provide some parents who are on the line with some helpful information. Thank you.
Well, you certainly have, Angela. I'm delighted to hear about those programs, and the ones that are in the works are just very exciting because they're so holistic. I saw my colleague Veronica sending up many, many thumbs up. So we really we love to hear about that. That is the kind of care and on the ground support that we know we need. So thank you for your work there. I
Welcome.
have a question for you, and others will probably follow. But as a public health nurse, what concerns you most about the health of the Black children that you see in schools or in communities?
Well, I wear 2 hats in public health because
Mhm.
I've spent half of my career as a communicable disease prevention and control nurse, and the other half as an early years nurse. So from a communicable disease prevention and control lens, the one concern that I have is disease prevention, and the ability for children and parents to make informed decisions and informed consent around vaccine, and to understand diseases, how they're spread, and how they're prevented. And that information, as I mentioned, like we don't collect race-based data in public health still. And so it's hard to know what communities are most affected by hepatitis C, what communities are most affected by hepatitis B, those and what communities are what schools do we see a drop in HPV vaccinations? So really, like in terms of communicable disease prevention control lens, that I am concerned that are people making an informed decision about vaccination, and do they have all the information they need about disease prevention and illness prevention? And then in terms of parenting and the early years program, uh, I would say that my concern in that, or I shouldn't say my concern, I want to say my hope is that parents will be able to advocate for themselves so that they can live and their parents and their children can live a healthy and happy life. That's my hope and that's my wish.
Well, you are not alone, and we will be working with you toward that, I am sure. And I do want to say that I hear the concern in your voice, and I hear the passion, and all of our panelists share that. You know, this is about putting our children first. So with that said, I'm going to hand it over to Dr. David and Veronica, who are going to facilitate questions from our participants, and I'll have a word of closing at the end. Over to you, colleagues.
Okay, so folks, you've heard a lot of wonderful information, a lot of stuff that really, some of it we knew, but then, you know, we've been sitting around and probably not adhering to a lot. A lot of it challenged us. So are there any questions from folks or even comments? What resonated with you?
I have a question and a comment for Dr. Upton. Is it?
Yes.
I'm sorry.
Yes, go ahead, Donnie.
My name's Darlene Lawrence. I'm sorry, my camera unfortunately is not working. And my question is around the vaccine and the mistrust. And from what I have been hearing from the Black populations across Nova Scotia, first, they do not trust the healthcare system for a variety of reasons, most of it based in anti-Black racism and how they're treated when they're seeking medical services by healthcare professionals. And of course, there's the misinformation, disinformation that has occurred with COVID-19 and has elevated to all other vaccines. And during COVID-19 vaccines, people really begin to question the Department of Health, the government, and any other scientific body about vaccines. People were so committed, and I'm referring to Black people, that they resigned their positions when they could not economically afford to do so, but they did so. They were so committed that they paid money for fake COVID-19 passports. That's what they were referred to in Nova Scotia. It was proof that you had your vaccinations, and they paid money for fake cards. This really speaks to just how intrinsic the cognitive bias towards COVID-19 vaccines have been and still are, and how that is being transmitted to, say, the routine childhood vaccinations. And it doesn't matter in many respects the level of education or their career or professional status, because it seems to transcend whether someone had several degrees or was working in professional occupations, the sentiment was the same. I do not know how or what approaches one would have to take to challenge someone's cognitive biases. Because one of the dangers about having these types of biases is that you dismiss any information that challenged your bias. You dismiss it. And you go to the information that supports your biases, which would be the all these websites that are still operational today. Do you have any suggestions?
It's a really great question. There are a few points I will make. It's first comment is that in terms of solutions, it's going to require a multifaceted approach that is going to need to be customized to target specific groups of individuals. Starting with trying to get a better understanding of why people are hesitant. What is it that we need to do to enhance confidence? I'll make a couple of comments in that regard. First, we recognize that many individuals have many good reasons for not trusting the healthcare system. There have been lots of historical atrocities, and we need to recognize that. And so for these individuals, the healthcare system and the powers that be need to work very closely and carefully with communities to enhance trust, because people have lots of good reasons not to trust the system. The challenge is that when one use historical atrocities to influence their current day well-being, in a way, they, meaning us in the Black communities, we're being victimized twice. Because first, these atrocities occurred. We don't trust the system. Because we don't trust the system, we put ourselves at the back of the line when it comes to health advancement that would benefit us at this point in time. So we've been victimized twice, and there's, so work needs to be done to address that. I made reference to a multifaceted approach targeting different individuals with different background in terms of knowledge. We've seen situations where it wasn't necessary to have conversations with healthcare providers, doctors and nurses, who themselves were making decisions around vaccines based on wrong information. Because your physician or your nurse doesn't necessarily mean you have the right information to guide the decisions that you might have misunderstood the science. And so it's important. One of the things that we've tried to do is to have what we call an educator series, where we ensure that healthcare providers themselves are equipped with right information. So there isn't a perfect answer to the challenge, but what I will close by saying is restating the observation, and the observation is that we have a lot of well-established reasons not to trust the healthcare system. But if we use that historical, injustice to totally drive our decisions today, in many cases, we end up victimizing ourselves twice. Or at least not we're victimizing ourselves, but we're victimized twice.
Thank you.
Thank you, Darlene, for that very good question. and Dr. Upton for your response. Does anybody else have any comments or pressing questions? Dr. D, I think you have one, do you not?
Well, I have a quick question for Angela about is anybody in Nova Scotia working on a vaccine registry? I know you're not collecting data by race and ethnicity, and I hope that's coming. But what about a vaccine registry? And people are talking about a national registry as well as local. Is there any work being done on that?
Yes, the public health is developing a vaccine registry in our panorama system, so that eventually we'll have all vaccines recorded. So we it's hard to backtrack if family doctors or nurse practitioners didn't
Yeah.
send in the reciprocals. So we have to, go with what we have and move forward. But yes, they are developing a vaccine registry.
And do you know if that's going to be linked nationally as well?
I'm not sure.
Yeah,
I'd have to
okay.
check with Department of Health and Wellness to see if
Yeah.
it'll be linked, but I hope
Upton,
so.
do you know anything about national?
You
What's
know,
being done in Ontario?
yeah, David, you've hit the nail on the head, and it's something that I know that Noni and Scott and others, Noni MacDonald and Scott and others in Nova Scotia have spoken about for a long time. Is that in Canada, when it comes to vaccines, in fact, when it comes to the healthcare system, as you know, we are like many different countries. And so having a unified approach is a desirable goal, but and I'm sure Angelo can speak to this as well. We're not there yet. So but yeah, it'd be great to have a national database, but we're not there yet. Elements of that are not in place yet.
Any other questions from anybody? Well, I put in another one as well. So this is from all. I mean, we've just so enjoyed your presentation. It's just been delightful to kind of have you all come together and provide these presentations. And I just going to throw a question out for each of you to take in turn, because when you think about the health of our Black children and the needs that our Black communities have, what are the best, what in your opinion is the best way for our Black communities to come together? And I use communities broadly because we're all part of these communities, whether in healthcare or education or social work, or what do you think we all need to do to come together as a village, so to speak, for the health of our Black children? So maybe we can go in order of the speakers. So Lana, and then Karen, then Dr. Upton, and then Angela. What do you and I hope that question isn't too.
Yeah, thank you,
Yeah.
David, for that question. I think it's really requires some reflection, but my initial reaction was convening the best brains that we have to have biannual conferencing, which engages youth and children from their lens and their perspectives alongside those of us who work with them. I think, what really works for us is when we gather together collectively, honoring our different points of view as we've done today, and seeking out the best of who we are and creating emerging best practices. Because we do not have the data, being intentional with encouraging our people in the academy and physicians and other clinicians who can be partners with us around getting the data we need to have informed decisions that meet the best interest of our children. The simplest thing I want to kind of piggyback on Karen as well. So for me, it's like I like thinking academically about how we can do it and collaboratively how we can do it. And then there's that part of my heart that says, in honor of Terry Simon, said, can we just, each one teach one? When, can we just be in relationship with each other? Can we model goodness, kindness, grace, humility, love, and compassion to our children? Sometimes we're not compassionate with them. Can we just do some things when we see a child who we think may not be getting certain things met, as Karen said, in the village, or in the concept of Ubuntu, I am because we are. And as I'm getting older, I'm closer to 60 than I am to 50 right now. I'm thinking, these are the people who are supposed to be responsible for me when I'm old. And if we do not, and I'm like, if we do not invest in them to have some grace and mercy, as we show them what grace and mercy is, love, kindness, the fruits of the spirit, I would say. And if they not, some parents and don't have that bandwidth because they've got competing priorities. I got love not just from my parents or my grandparents, but people in my community showed me love. And that's part of what we do to mitigate harms to the psychological wellness to our children, just showing up in small, meaningful ways. My grade 3 teacher was the first Black teacher I had, Miss Phyllis Arthur. And and she reminded all the little Black kids in the class that you can do anything. You can do anything. And, it was those pieces of those little tiny things that we say to children that invest in them in meaningful ways. And if anything, yeah, I think that's, I'm going to, from my head to my heart, those are
Okay,
the things I would say.
great. Karen?
I'm going to
Anything?
piggyback what Lana
Sure.
just said. I love all of that. Whatever we can do to involve families and whatever the family composition looks like. And like I said before, you said Ubuntu, right? So I'm talking about all families. So it could be, you know, mixture of families, communities, which are families in terms of our church families, and then really partner with individuals who are advocating for the well-being of our children. So that means organizations, all of us that are here on this call here, that if they're champion our people, we need to make sure that we bring them in and bring all levels in, from the babies. When we were going to meetings, we had the babies with us. The babies came with us and they heard what we were saying. And so by them hearing that, they start to get involved with that. We need to bring them with us and not leave them home with somebody else. Bring them to the meeting so that they start hearing this information and we start passing it on. So that way when you go to these conferences, it's not just us. We're here passing the torch. So making sure that everyone has input into this information. So I think I'm going to leave it at that because, Lana, you said it in terms of, these conferences, the ones that have the knowledge, the researchers, they need to be part of community. You can't be just out there doing your research, but making sure that community's involved with that knowledge and help, bring them along with you. So I'll pass it on to Dr.
Okay.
Allen.
Okay, thank you, Karen.
Yeah, it's really tough. It's really tough. I do feel that Black communities need to be more engaged in the information generating process. I don't, I'm not using the term research, but more broadly, research is part of that. So that information gathering process, I think we need to be more engaged. We need to be part of it. We need to be leading it. And we need to be asking the questions that need to be addressed. So that's on one hand, then the information gathering process. We need to be part of that, and we need to push the powers that be that to say, listen, you can't do this unless we're part of it, we're leading it, co-leading it. We don't do it for us, right? I think that's really important. The second part, which is the other side of the whole information, space, relates to ensuring, David, that we have in place mechanisms to information share, not just in terms of data from that information gathering process, but just sharing knowledge around vaccines, around nutrition, obesity. That's a big deal. We gotta, we need to work on that. And so in some communities in Ontario, we and others have identified ways that communities can get some information. And for example, I know one particular community where, that information comes from the church, sessions at schools, and their community health centers. So one, has, clearly then in those situations, one has identified pathways through which folks will get information, recognizing that not everyone is going to be able to access electronic media, email, WhatsApp, and so on and so forth to get information. So on one hand, information generation and be part of that, and two, the information dissemination part of it, it needs to be more structured and accessible.
Okay, wonderful. Angela, you have the last word.
Okay. I'll be very brief. It just comes from my heart. So I think we need to build on the strength of everyone. Everybody is an expert. Everybody knows what they need to be successful in life. Build on the strengths of everyone in your community. Parents know what they need to be successful. Parents can set their goals.
Beautifully said.
That's
I guess it's thank you thank you so much. Thank you so much to each and every one of you, and for those who have joined us this evening, the co-facilitators, the panelists, and the participants, all of you. And I think you all have said it, and I don't need to repeat what you've said, but what strikes me is that we need a revolution of caring, a revolution of putting our children first. We must do something. We must action this feeling that we have to support our kids, and that parents and guardians and communities, you know things. You're valuable and your knowledge is important to this. We are the ones. We are the ones we've been waiting for. So let's do it. Thank you to all of you. God bless you all. And this is a recorded session, which will be available on the HAAC YouTube channel. Please let people know that they can see this at any time. Use it as a resource in schools, in libraries, in homes. Use it. This is an exceptional opportunity to have all of these wonderful people together talking to Black people about our health and the priority of our children. So thank you again, and have a wonderful evening. Good night.
Thank you all.
Good night.
Take good care.
folks.
Good night.
Thank you all.
Night.
Thank you.
Thank you.
Is the recording done?
Thank you.
I know.